So why self-care? Why is self-care truly important? So people in the self-service sector that enter caring roles really just want to help others, but it's stressful work. And for nurses, it's a complete recipe for any kind of burnout, compassion fatigue, because you're meeting other people's needs and oftentimes neglecting your own. So, nurses are really trying to be the lifesaver. And essentially, you can't save a drowning person if you don't know how to swim. Or how can you be well tuned and see yourself as like an instrument per se and help others if you're not in tune with yourself? So the difference between the two trajectories is how reactive versus proactive you are in addressing the stresses of your work and the ability to achieve work-life balance. So if you go up the model, you can see that if you're too altruistic or you're really having a lot of poor self-care, it could really contribute to exhaustion, compassion fatigue, and burnout. However, if you decide to do the bottom role and you decide to have great self-care strategies, it can contribute to a term called psychological resiliency. And that is really the goal that I want all of you to be able to achieve on your own at the end of this presentation. And I'm going to talk a little bit more about psychological resiliency in the upcoming slides. There are many consequences to poor self-care, and it's really all about the work-life balance. As you can see in the diagram, there is work on one end and family or your relationships and people that are really important to you in your life on the other end. And on that grid, you can see that if you are too much work and not enough family, it can leave you really dissatisfied and stressed. And conversely, if you had too much family and not enough work, well, you'd be jobless. I mean, I'm sure we would all really enjoy that, but most of us have to work, unfortunately. So it's how do we get to that medium, that perfect amount of work, perfect amount of family, so then we can be able to achieve happiness. Because in quotes, we really want to work to live and don't live to work, but know how to balance your life. Because it's through that balance that we can really achieve happiness. This slide is going to talk about psychological resiliency and how we can understand what psychological resiliency is and even what is out there in the literature about psychological resilience. So Reese et al. Had this great article about psychological resiliency, and he defined it as overcoming adversity and adjusting in a positive manner to maintain well-being. And he also decided to comprise it into 4 different components, such as neuroticism, mindfulness, self-efficacy, and coping. So he had this really interesting model, and I hope you get a chance to take a look at the article that's in the references, because it's really interesting about how we can develop psychological resiliency. Also, the APA.org wrote this great article about the psychological resiliency of a person, and they defined it as the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant source of stress, such as in family and relationship problems, serious health problems, or workplace and financial stressors. So essentially, it really meant coming back from a difficult experience. Because research has shown that resilience is ordinary and not extraordinary. So people commonly demonstrate resilience, and actually one great example of how Americans were able to be resilient was on the 2001 9/11 terrorist attacks, and how the individuals were able to rebuild their lives after such a tragedy. So being resilient doesn't really mean that the person doesn't experience difficulty and distress. So I don't want anybody to misinterpret me when I say that. It's because emotional pain and sadness are common, and it's a very human emotion in people who suffer major adversity or trauma in their lives. In fact, the road to resiliency involves considerable amounts of emotional distress. So it's really not a trait that people have or don't have. It actually involves behaviors, thoughts, and actions that can be learned and developed in anyone. So this grid here really goes over a lot of the psychological resiliency components. And the first being confidence, the next accountability, self-awareness, adaptability, and sense of purpose. So all of these are really important components that can help effectively manage change, how you can be able to have emotional mastery and take full responsibility for your own life, have some self-acceptance and belief in decision making and being optimistic, and ultimately finding strength through a sense of purpose and consciously showing compassion for self and others. So this is going to explain a lot of the strategies that are going to be used to mitigate stress. And these are the topics that I'm going to highlight in this presentation, such as mindfulness, meditation, aromatherapy, Reiki, diet and nutrition, sleep, and time management. And I really liked this about a nurse comic clip because it really can highlight what nurses and even nursing students are commonly feeling. They said, I was suffering from burnout, but with some time off and a little yoga, it's starting to go away. And I find that when you find a self-care strategy that works for you, because not all of these are going to, make you happy or really help relieve stress for you, but even if you could take away one thing from these strategies and employ them into your own life, that is really what the goal of this presentation is. Mindfulness is one self-care strategy that you should consider employing into your own life. Mindfulness is a really great and straightforward word, and it actually just suggests that the mind is fully attending to what's happening, to what you're doing, to the space you're moving through even. And that actually might seem trivial, except for the fact that we often veer from the matter at hand. Our mind takes flight, we lose touch with our body, and pretty soon we're so engrossed in obsessive thoughts about something that happened or fretting about the future that it just fosters anxiety. And is that really something that we need? No. Anxiety is something that we produce in our own minds. But anxiety is a normal response. It is something that is experienced in over 95% of people at some point in their life. And it's not really that anxiety is wrong, but it can sometimes be irrational or obsessive. And it's how can we minimize this? How can we minimize obsessive thoughts about taking a nursing exam or worrying that far down in the future, will I be a nurse? It's all things that if you were to stop and be a little bit mindful and be present of what's happening and be aware of where we are and what we're doing, you won't be so overly reactive or overwhelmed by what's going on. So the UMass Medical School's mindfulness-based stress reduction program wrote these 4 aims about if you are looking to ... and you can use this as an ability to reflect of whether or not mindfulness will be right for you, such as to approach your life with more composure, energy, understanding, and enthusiasm, develop the ability to cope more effectively with both short-term and long-term stressful situations, enhance your ability to manage and reduce pain in many instances, and improve your focus, resilience, and capacity to recover more quickly from challenging events. Aromatherapy is another great self-care strategy that you can use, and the great thing about it is that you can just inhale and go. Essential oil therapy is commonly used among holistic practitioners or even the lay people, and there's a lot of great research out there right now that is using aromatherapy for the exact reasons of reducing stress, reducing anxiety, and even grounding. So I just put a few aromatherapy oil blends that would be really helpful for you if you were to be very stressed, such as lavender, cinnamon leaf, cedarwood, lime, and grapefruit. There are also a lot of great companies that make aromatherapy. Just make sure that whenever you're going to buy aromatherapy products, use a 100% pure grade oil because you don't want to use anything that has been watered down or will not be really effective for you. But lavender in particular, I highly recommend, and there's a lot of research out there on lavender and stress reduction, and it really has shown some really significant results. So lavender is a really great tool that you can use, and you can just put it in your pocket, you can inhale it, you can put it on your skin, and it's just going to provide benefit all day or at the moment or even prevent a stressful situation from happening. So I highly recommend that you use aromatherapy if something that is for you to smell is helpful for you. Although if smells are very sensitive to you, or sometimes if you have really sensitive skin, aromatherapy may not be the best option for you. Or you can just try to just gently smell it from afar. Reiki is another self-care technique that you may or may not have heard before. So what Reiki is that it's a Japanese technique where the person uses their body as a conduit of universal life force energy and uses their hands to act as a conduit for that energy to be on their body, with the ultimate purpose of promoting relaxation and healing. So I really wanted to stress how in the hospital settings, especially in Boston, you're going to see a lot of Reiki practitioners that are volunteering to either offer Reiki to staff or to patients to help promote wellness and relaxation. The great thing about Reiki is that if you decide to ever be a practitioner, you can offer Reiki to yourself. And when you use hand positions, such as the ones in this diagram, you can see that when the hands are placed on or over the body, you can help align the chakras that are carrying a lot of the stress that is going on in your body and hopefully help restore it to balance. So Reiki can be really helpful whether or not you are working in a very stressful situation or prior to exams. But if you ever decide to just try Reiki for yourself, you can always seek out a Reiki practitioner if you are going to anticipate a future stressor, so then you can be able to have that wellness ahead of time and hopefully be able to be more productive. So diet and nutrition are really important things to look at when we are considering self-care strategies. Mainly because food is what gives us energy and is what is able to get us to do the things that we do every single day. So if you go long periods of time without eating, for instance, your body is unable to function at its best. So if you're going out on the nursing units and you're not taking your break like you're supposed to, then how are you able to fuel your body well enough to be able to provide care? Because you don't really think at times that when your brain is starved of that glucose or carbohydrates, for instance, you would end up experiencing that fatigue, that low energy levels, or even a headache. Or even if you decide that you're going to just be walking around the entire shift and there's so much movement that you may not have even the best energy to do it. Because food is what gives your cells the energy that they need to accomplish the tasks. It is that balance of the fats, proteins, and carbohydrates that can really get you to perform optimally as you're nourishing your cells at the same time. So having that balance of the energy trifecta, or the 3 main nutrients, it will help keep your blood sugar levels more stable and energized throughout the day. Also, food can really impact your mood because food provides components that really contribute to the hormones in the body that regulate your mood. So, carbohydrates and proteins really affect our ability to make serotonin, also known as our feel-good hormone. Both of these macronutrients contain important vitamins and minerals that affect our neurological state. So, when our cells and brains are not receiving enough of that fuel, we can really be irritable. And this is also pleasantly called hangry. So on the opposite side of the spectrum, if you were to really eat too much, you get that whole Thanksgiving fullness of lethargy and you just want to go take a nap on the couch. So both of those extremes are really not good for your mind, they're not good for your body, they're not good for your metabolism. So it's really being mindful of how can you tune into your signals of hunger and fullness and figure out when you are feeling satisfied enough and what is that level of satisfaction. So nutritionists are recommending that if you can try to be around a 5 or a 6 out of 10 with your fullness level, that is really where you should be when you stop eating, and you should not eat anymore. Lastly, food provides comfort and satisfaction. So I know personally I'm a big foodie, so I love to eat, and eating is something that really brings a lot of satisfaction and comfort to me. I mean, we were given taste buds because food is pleasurable and meant to be enjoyed. Ultimately, food tastes good and it helps keep us alive, and it really is satisfying, but it's when you go into that nursing break room and you decide to go for the bag of chips and you're fueling your body with those comfort foods is when it really can turn into more of a coping mechanism and a stressful choosing something quick than something that's actually going to help your body produce energy. So if you're often finding yourself just trying to soothe either uncomfortable emotions or really not engaging well with the food in general, try to look at yourself with a little bit more self-compassion and ask yourself, what are you really needing in the moment, and experiment with alternative activities that can address what you may be experiencing if you decide to overeat or eat a lot of the wrong foods. Because nourishing your body is one way that you can really cultivate health, and that is a really great self-care strategy that you can use. Because through the act of eating, you are investing in your life as food is full of nutrients, and it can ultimately help you care for and allow your body to function at its best. Sleep and time management are two big issues that I find that many people struggle with, and especially with sleep. Sleep is something that not enough Americans are getting enough of, and it's something that as nurses and nursing students, you really need to try to consider that sleep is a really important thing to be able to get you to be at your best. For instance, if you're a nursing student, having a higher GPA is always the goal. You always want to be able to pass that exam. You want to be able to perform optimally and really be able to showcase that you have learned so much. So being able to have enough sleep will help your brain be able to do that. And in turn, it ends up decreasing counterproductivity. It can improve your memory, learning, and mental performance, and ultimately improve your mental and emotional health. Because nothing is worse than when even a child needs a nap and you're just like, oh my God, you are a nightmare. So that is ultimately due to a lack of sleep a lot of the times, and that children need sleep. And I really think that even can be the same for adults. Adults need sleep. Adults need to be at their best. As much as we like to think that we can function on 2 hours of sleep a lot of the time, really oftentimes we cannot. But in the long run, you will be able to prevent disease and increase your lifespan and even maintain a healthy weight. And then with time management is something that everybody can be able to use. And there are a few strategies that I wrote down, such as getting a calendar and using it, that can help you be able to stay focused, get what you need to get done, and ultimately plan ahead. So the key is what will work for you to be able to write it down. Is it to get a planner or even use the calendar in your phone app? Whatever it is that can be able to say, I'm going to study on Mondays, Wednesdays, and Fridays, or okay, I work 12-hour shifts on Tuesdays and Wednesdays and Saturdays. I can try to make room for my friends on Friday. Whatever it may be, it's being able to manage your time so then you can have flexibility. You can be able to have that work-life balance. You can be able to study for your exam and still be present for your friends and your family. So then you don't get that fatigue and burned out. Or better yet, prioritize. If you have so many things on your list, what can you cross off? Because if you're overcommitting yourself and saying, yes, 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 I'm going to do everything, that's not taking care of you. That's just saying yes to say yes. And it's just really important that when you're really busy and you have that big nursing exam coming up, you can just say, no, I really need to study today. Like, I understand that you need my time, but maybe after the exam, I can meet with you. Anything that can really just help say to yourself, okay, I really need to take this time for myself. I need to sleep. I need to plan so then I can be less anxious and more productive.